which unfortunately are very variable from patient to patient and often are quite different between the right and the left side of the face. The key to safety when operating in the facial soft tissue is to understand three-dimensional anatomy and where facial nerves are more superficially positioned and can be more easily injured. The purpose of this video vignette is to try to identify those danger zones. Here you see three danger zones where the facial nerve branches are quite superficial. The superior one marks the danger zone of the frontal branch, which sits directly anterior and inferior to the anterior branch of the superficial temporal artery. The nerve, as it traverses toward the frontalis, tends to be superficial, and if you go deep to the SMAS in that region, it lies between superficial and deep fascia and can be injured in that location. The second one, the middle X you see in this cadaver diagram, is just lateral to the zygomatic eminence at the upper border of the mesenteric ligaments. This is a danger zone for the zygomatic branches because the zygomatic branches going to the zygomaticus major tend to penetrate the deep fascia to innervate the zygomaticus major along its deep surface in this region. For that reason, if you go deep to the SMAS, you can get a nerve branch injury. The third danger zone is along the caudal border of the masseter, which you see along the mandibular border. If you go deep to the platysma in that region, the cervical branch going to the platysma sits directly deep to the platysma in that area, and you will get, again, depressor lip dysfunction. Just to reiterate, the danger zones you might encounter in doing a subcutaneous dissection in a facelift, where if you go deep to the SMAS, you can get a motor branch injury. Firstly, the frontal branch, as it approaches the frontalis in the temporal region, becomes more superficial, and it sits just deep to the superficial fascia in that region. The zygomatic branch that goes to the zygomaticus major, just along the lateral aspect of the zygomatic eminence, penetrates the deep fascia lateral to the eminence, and again sits just deep to the SMAS in the region of the upper mesenteric ligaments. And finally, the cervical branch exits the parotid and then rapidly penetrates the deep fascia to lie just deep to the platysma, and it tends to innervate the platysma along the caudal border of the masseter. So these are the three danger zones that you need to think about when you're working in the subcutaneous plane in a facelift. This cadaver photo demonstrates the zygomatic branch going to the zygomaticus major, sitting in the plane between superficial and deep fascia, just lateral to the zygomatic eminence. The upper arrow points to the zygomatic branch, while the lower arrow points to a major buccal or zygomatic branch that parallels the parotid duct. And in this cadaver photo, you see the cervical branch, which sits in the plane between superficial and deep fascia, just deep to the platysma. The upper arrow is pointing to the facial artery and vein along the anterior border of the masseter, while the lower arrow points to the superficially situated motor branch. In summary, the key to safety when operating within the face is to understand three-dimensional anatomy and understand the plane of dissection and its relationship to the plane of the facial nerve branches. In an absolute fashion, dissection superficial to the SMAS is always safe, while dissection deep to the SMAS is typically safe except in the area of the danger zones where the facial nerves remain superficially positioned.